thewellnesscouch.com, streaming wellness into your lives. Download the app today.
This is Up for a Chat with your hosts, Cindy O'Meara and Kim Morrison.
Here we are, up for a chat about the hottest topics that are important to you, inspiring you to awaken the change within. I'm Cindy O'Meara.
And I'm Kim Morrison. What a delight it is this week to have a very special soul on our show. Dr. Scott Wustenberg is far from your average chiropractor. He is a passionate teacher in nutrition, chiropractic neurology, as well as sleep airway medicine. You are going to love this incredible soul. I don't think I've met anybody that studies and researches more than this human, but also has a very holistic, integrative approach to health. Welcome to Up for a Chat, gorgeous Scott.
Thank you. That is very kind of you.
Well, you know, I've always been a massive fan of yours. But for the listener, just so that they can understand your pathway and what took you down this beautiful, holistic, integrative approach to life and health, maybe you could give us a little background as to where it all began for you and what led you to what you're doing today.
Well, that's a wonderfully complicated question. There's several parts of it. One of which is that my darling uncle, now recently deceased, is a chiropractor and was my inspiration to become a chiropractor. Now, Dr. Scott Parker set up the Sacro-Occipital Technique Association here in Australia and New Zealand, and was the first person to be teaching the basics of the technique that I use. So that was my inspiration to become a chiropractor. From there, I met my beautiful wife, fell in love, got married, and then we had kids. And having kids doesn't always turn out to be quite what you expect. You have all these wonderful ideas about your kids are going to be rocket scientists and everything's going to be smooth sailing. But my eldest decided to buck that trend, and by about 18 months descended into autism. And by 4 was nonverbal, non-toilet trained, staring into space, not having a very good time. And there was no real help occurring. We went to the pediatricians, we went to GPs. I tried everything externally. And so I believe our children come into our lives to help us learn equally as much as we have a responsibility to grow their lives. So I had a simple choice. She could stay as she was, or I could retrain myself and relook at everything from a different aspect, trying to figure out how to get her to live her best life, which has been one of my overriding goals. And then we had 2 further children, and both of them have had challenges, and it's forced me to keep learning and trying to find new and better ways. And the help that or the things that I've learned to help my daughters have then translated into helping other people and establishing a practice that deals with people that have less common symptom patterns, things that aren't healing in the traditional Western medicine style of things that are difficult. So that was my inspiration, and still continues to be my inspiration. My eldest daughter is someone who I'm immensely proud of, who's gone from being unable to talk, to communicate, to be able to look anyone in the eye, to working in my practice and being a chiropractic assistant and technician, actually doing testing with patients. She's empathetic, she's loving, she has a life. And so I'm immensely grateful for the information that came to me to be able to help her have a better life.
Well, first of all, Scott, I'm sorry, I said Scott because I thought Scott Parker and you are related.
Yes.
I cannot believe it. Scott Parker has been in my life for as long as I can remember, because him and my father were wonderful friends. Yeah,
Yes.
like I didn't realize you were his nephew. So first of all, it's so exciting that you're part of that incredible chiropractic family I know so well.
Thank you.
And you know what I find is that often our own health challenges or a child's health challenges is something that takes us far and beyond what we would have ever have thought. I would say that a lot of people listening right now would be wanting to know exactly what you did in order to educate yourself in order to help your daughter, especially when you're telling me that your daughter was nonverbal, incontinent, everything going on, and yet now she's in your practice working as a chiropractic assistant. So a lot of people just see their children get worse and worse and worse. What was the impetus? What was what you did that created that change that enabled her to obviously live her best life?
There's a bunch of things. And I went and studied. So I have a master's in nutrition medicine and studied with some very, very brilliant medical doctors here in Australia. I had joined a medical fraternity called ACNM, which looks at integrative and environmental medicine. The first thing that I did that really gave us impact on my darling daughter was we changed her diet. And I went to a seminar, and at that seminar, I basically learned about some of the interesting impacts of food, including gluten and dairy products. And it's interesting that gluten and dairy become quite controversial. Some people say these things are the devil. Other people say it's all a fad and everyone should be able to eat these things. But underneath are these peptide molecules, which in both gluten and in casein, we've got these double proline bonds that human beings don't digest. We just don't. We don't have the enzymes for it. And when you partially digest the proteins, they can break down into these long, floppy peptides that have a similar structural shape to opiates. They actually bind to mu opiate receptors. And what we found with my daughter, and other people have this benefit and other people don't have this benefit, but in my daughter's case, when we removed gluten, dairy, and sugar out of her diet, we got significant change. After 5 days, we started to have words coming out of her. By a week, we had sentences. So it went on to show that there was a significant amount of development that was going on. She just wasn't able to express, partially potentially because she was stoned a lot of the time, because she had narrowed her diet to very beige food. All she really wanted was sugar, bread, that sort of high carbohydrate, high opioid food. It was stress survival food, if you ultimately look at it. And this was some of the things that I've learned along the way, that ultimately the brain has a drive for survival. So it will make decisions about your short-term survival, not your long-term survival. And there are structures and reasons for it. And it's guided me. My daughter's patterns along the way have guided me to look at retraining with people like the Carrick Institute and Dr. Robert Malilo in functional neurorehabilitation. And so we look more at these things, and it's led on to me looking more at airway and the structural inadequacies, because right along the way, what we found is that she had cranial maldevelopment and an overbite and poor dentition. And I heard all sorts of things by different practitioners. I got told that I was a bad parent for not brushing her teeth enough. And we got, lots of guilt tripping along the way. But as it turns out, if you miss certain things because it's not taught to you to look for it, such as tongue tie, you find that the children will mouth breathe. And if they mouth breathe, they will lower their oxygen levels because it creates situations of hypopnea. And that open mouth breathing dries the mouth out and allows bacteria to attack the teeth, especially if you live in less healthy, more, mold infested or bacterial environments. And one of the houses that we lived in got severely flooded and had significant amounts of mold growing in the walls, unbeknownst to us. So this all creates these autoimmune scenarios that, of course, have negative compensatory aspects to the nervous system. You just can't survive or thrive in those situations. So unfortunately, it's not a simple, I just did this, but there were many different learnings along the way that have allowed my kids to step up and step up and step up. But, to that end, if I had one thing that I wish I had learned much, much earlier on, was the concept about tongue ties and their massive impact and oral maldevelopment functionally, how it affects how the brain develops, how it affects primitive reflex retention, how it affects facial development, and then has these flow-on effects into how the kids manage in the world. Because if you're not breathing, you're decreasing oxygen supply to the brain, and this drives oxidative stress, and it drives threat response, and it drives behaviors that are not optimal. So yeah, there was lots of really important learnings along the way, but changing the diet was a massive one. And we just have continued to trial different things along the way. We've done well with chiropractic, but ultimately I'm a heretic to my group in some ways, because chiropractic didn't make the difference for my daughter. It maintained her, but it didn't pull her out of it. That's why I had to go to these other things, looking at biochemistry, looking at physiology, looking at sleep, looking at airway, to try and find answers that were being overlooked by the tools that I had originally. So, yeah.
It's an incredible thing, really, when you actually look at how complex this is. I mean, you are already someone who goes down the rabbit hole of research, and you also have a degree behind you. For the everyday mum and dad who has a child that does have perhaps similar conditions or other conditions, it's really challenging to know you are guided by the medical profession or by people who you feel are in the know or that they know more than you do. What would you say to the average person who doesn't have your knowledge or thirst or quench to go down that biochemistry route or the nutritional route, or didn't even know to do that? Would you say chiropractic is still a great starting point, or would you recommend anyone listening to this that they just have to see someone like you?
Well, of course, my narcissism says, see someone like me. Yes, I do think chiropractic is a great starting point, because ultimately, in all the learnings that I've done across the last 20 years, my thought process is the brain runs everything. And chiropractic is about trying to take away distress, imbalance from the normal function and flow of the nervous system. So I think a well-trained practitioner is an essential to look at that nervous system function, just like a neurologist, pediatricians, as long as they have a neurological bent. But at the same time, my viewpoint is that to make a nervous system function, you have to have building blocks. So if you're not looking at nutrition and biochemistry, you're not allowing the nervous system all the tools it requires to run the person effectively. And again, it's complicated. It's not like, oh, everyone can do what I've done. I'm not trying to say that. But the real message that I would like people to take on board is never give up hope. There is always an answer. You just need to keep overturning stones and keep looking underneath them. Every child has a slightly different story of how they got to that difficulty, so to speak. But there are signposts that if you know what to look for along the way, you might make it easier. And in fact, as a shameless self-plug, I wrote a book about some of this stuff recently called First Principles. And it's basically talking about oral airway functional maldevelopment syndrome, which is something I think all parents out there need to know about if they're having, well, even if they're not having major difficulties like autism or ADHD with their kids. Airway dysfunction can create sleep dysfunction. And if you're not sleeping, you're not healing, you're not growing, you're not thriving. So looking at the oral airway and how it affects breathing, sleep, health, immunity is an essential thing for all of us to be looking at. And they're quite simple things to assess. It's either there and it's functioning poorly, or it's not there and it's functioning well, and you don't have to worry about it thereafter. So yeah, if there was one thing, it would definitely be looking at the oral airway function and how it impacts on sleep and therefore has an effect on every other aspect of child and human development. There's a big statement for you.
It's a huge statement. But it's not only affecting children, but it's also affecting our adult population, there seems to be like more and more people not sleeping, and more people that are either snoring or got sleep apnea. And it just seems to be like, I never heard about this, Scott, in the 60s, 70s, 80s, and even 90s. But now it seems to be something like every time I open up my Instagram these days, there's an ad for a snoring device or a sleep, there's always something about sleeping. So, or snoring. So there's something happening not only to our children with regards to that, but also to the adults. So where I'd like to, because I've got so many questions for you running in my head, but where I'd like to start, I guess, is tongue ties. Why do you think that there is an increase in tongue ties in the last, I think I've only started to hear about them in the last 10 years, maybe 15 years. There is an increase in tongue ties. Like I feel like it wasn't around much in my era, but it is now in these next generations that are coming forward. And did your daughter have a tongue tie? Is that where this all started?
Yes, it did.
Yeah.
So there's different parts to that question. In the first instance, all three of my daughters have tongue tie or had tongue tie. I have a tongue tie, which I've had surgically altered. My wife had a tongue tie. So the concept that you're looking at is tongue ties have always existed. They are a midline structural fault associated with certain biochemical and epigenetic SNPs, including things like MTHFR, which has really only made kind of big noise in the last 15 to 20 years. So MTHFR affects the ability of the body, both the mother's body and the gestating infant's body, to utilize folate. And if you can't utilize folate properly, you can't make fibroconnective tissue, you can't make cartilaginous tissue of the cheeks, jaw, mouth work effectively. And all of this starts occurring and potentially going wrong about 5 weeks into the gestation. Now, I would argue with you that we're not actually seeing more necessarily. These things were always there, right? We've always had tongue tie, okay? And it's especially prevalent in Celtic and Viking populations, okay? We have, or appear to have, depending on whose studies you look at, more of these MTHFR faults than perhaps other groups do. Now, that could be for a variety of reasons. Maybe the Western Celtic population tends to be doing more studies on it, and we're not seeing it in other. I don't know the answer to that one, but from the things that I've studied and read, the population that I'm related to, I have Viking and English Celtic ancestry, we have a tendency towards more folate issues, more B12 issues, and there are several other epigenetic SNPs, including retinoic acid binding protein, which is for vitamin A. And when these things go wonky, we get more midline structural faults. That includes like inguinal hernias, belly button hernias, greater amounts of fascial tension in the neck and shoulders, postural discrepancies, and it's all starting in the pregnancy. Now, the literature shows that midwives 100 years ago kept a sharpened fingernail to assess the baby and cut the tongue tie at birth. And this has fallen out of favor for a variety of reasons. It could be that we developed kind of rubber nipples, and tongue tie has created lots of issues with breastfeeding. So if you couldn't breastfeed, the child would starve and die. Now, if those children are continuing to survive, and this isn't meant to be macabre, but if they are fed with a bottle and they survive and continue on, they have a greater tendency to have kids themselves and pass on the genes leading to further amounts of tongue ties. So that's one mechanism for this increasing in the environment. But what occurred one way or the other is it became out of favor to deal with the tongue ties early on. Now, health is a continuum. Whatever you have as a child continues on through your life. So if the tongue tie was missed in the child and was causing minor problems while they were flexible and bendy. But as you get older and stiffer and tighter, you can't flex around that tongue as much, and this leads to a greater degree of occlusion of airway. Now, the problem with this is, of course, we're seeing more overweight people, and there's a doom loop around all of these conditions. If you have fragmented airway, it increases inflammation, which drives insulin resistance, which drives weight gain, which drives difficulty with airway, which drives, and we just create on and on cycles. So again, since the 70s, we've had an increase in industrial food, higher amounts of processed foods, greater amounts of sugars and breads, and things that may not have been consumed in the first part of last century. So our population has gotten bigger. We're seeing more estrogens going into both the population via contraceptive medication, potentially in the food from xenoestrogens in the antibiotics fed to the animals. And that's driving a greater amount of mass gain. We are significantly fatter as populations for whatever reason. Now, the problem with that is, of course, weight around the throat, weight around the chest, weight around the diaphragm makes it harder to breathe, especially when you're catatonic at night. So if you're getting one of the really cool things is when we get fat, our tongue can get fat and gets thicker and bigger in the mouth and the airway, which of course increases the risk of occlusion of the airway and sleep fragmentation. Now, if you fragment your sleep, you don't heal. You can't get your brain to operate effectively, and you release a lot more cortisol, a lot more adrenaline, a lot more of these chemicals that leave you in chronic states of stress. It increases heart rate. It increases threat response in the body. Now, all of those things then lead on to problems with the vagus nerve and digestion and malabsorption. And again, we just keep creating doom loops. So overall, I think what we now have is people looking at something that's been latent and always there, but because of a confluence of a whole lot of factors, we're seeing it getting worse and worse and worse. But the apneas and hypopneas are worsening in the adult population, partially because their tongue ties were missed when they were babies.
How do you know if you've got one? It's just, now I'm touching the lower part, where my tongue ties. Yeah. How do you know if you've got one? Because I know that I do snore. I'm admitting it. My husband says to me, I don't do it all the time, but every now and then I will have a snore. And right. He says, so if it's not, yes. So that's why I'm asking. Yes.
So there's several ways. It's rather difficult for the average person. And one of the things that I talk about in my book is that tongue tie as a thing, and it's not just tongue tie, it's lip ties, it's buccal ties, cheek ties, it's all the fascia in the mouth and the airway. And so things to look for is, do you have a history of orthodontic use? And people in our age range tend to have had patterns where that we had orthodontics by pulling 4 teeth out and folding the teeth back. So they created kind of a structural change. So high arches are to some degree a sign of misuse or malformation of the tongue and potential for tongue tie. But the standard tools that have always been used, one's called Kotlow's tool, and it's for anterior tongue tie. So it measures the amount of frenulum tension. So the frenulum is the fibrous connective tissue underneath the tongue, connecting the floor of the mouth towards the tip of the tongue. So if it's very short, you won't be able to project your tongue out past your lip. And this is the standard classic tongue tie. But unfortunately, this doesn't work for the assessment of posterior ties. And so we look at things like, can you suction your tongue to the roof of the mouth? What's your mouth opening like? What's the shape of the mouth like? What's the length of the rami of the jaw? Do we have drooling? There's all of these symptom patterns that has to be assessed. And so there are a variety of people out there. There are cranial chiropractors like myself who look at these things, and TMJ trained people. There are sleep specialist dentists. There are myofunctional experts who are trained to look at the tongue, the mouth, the lips. Ear, nose, throat surgeons are also another potential avenue to look at these things. So, of course, I recommend everyone have this looked at. Now, one of the problems, though, is you go to an appropriately trained person who says, well, you're 55 years of age. Your tongue tie's not that bad. Will it really make that big a difference to you? It's a hard call. My statement and suggestion is you're alive and you have the capacity to improve yourself. Why wouldn't you want to consider some degree of rehabilitation in that area? Now, it may be that we don't do a tongue tie surgery, but we get you doing myofunctional retrainment, using exercises, retraining the lips. We might use a mouth guard. We might use a straw. So, another shameless self-plug, my company imports a thing called a myonozzle straw, specifically to train the tongue and oral function to become stronger and decrease the aspects of mild to moderate snoring and hypopneas. So there are things that you can do to intervene if you think there is actually a problem.
I just find this absolutely fascinating. So I have to tell you, so on my Instagram, and I said this in the beginning, there are these advertisements coming up, and it's an advertisement, it goes forever, and I'd listened to it because it was about snoring. And it talked about, it was the position of the jaw, and you've said the TMJ and how important that is. And they have these mouth guards that they put into their mouth in order to move the jaw forward to stop. And they show it all on, how it works. And you talked about mouth guards too. I just thought it was a gimmick.
Not at all.
Obviously, this isn't.
No. So the basic concept that you're thinking about and what they're advertising is because the tongue itself is connected to the jaw structure and down to the hyoid bone in the throat. So all of the kind of jowly bit underneath your jaw is tongue muscle, fascia, and potentially fat. So if we move the jaw and translate it forward, we are moving the tongue out of the airway. So if your tongue can't fall back because the jaw is structured forward, you have a more open airway and a greater likelihood of not snoring, not having hypopnea, not having apnea. And one of the things that I'll point out in a slightly kind of more scary concept, I'm not really trying to be histrionic here, but what people don't realize is that snoring is a type of hypopnea, and hypopneas and apnea are prone to leading towards increased dementia risk. They increase blood pressure, they increase stroke risk, they increase diabetic risk. So snoring is not, they just snore. Oh, isn't that annoying? Put a pillow over them, just nudge them a bit. Snoring leads to health consequence in the long term. It lowers oxygen to the brain. There is never a moment that low oxygen to the brain has a good end response. Now, surprisingly, the literature is very clear that apnea, which is full cessation of breathing for a period of time greater than 10 seconds of more than 10 times a night, apnea is actually less dangerous than hypopnea. Now, hypopnea is a shorter duration, kind of anything up to like 9 seconds is a hypopnea. And hypopnea causes a thing called reperfusion injury and is more likely to cause vascular dementia and brain decline, loss of memory, brain fog, etc., than apnea. I think the regularity of apnea allows the body a greater ability to adapt to it. That's my interpretation of the literature. No one knows exactly. So, snoring is one of those things that needs to be considered always. Obviously, I would recommend to you to see a professional who actually knows what they're doing when making and molding a splint, a TMJ mouth guard. because if you use the wrong device, you could cause yourself an issue, especially if you've got a TMJ, a jaw joint that is prone to dislocation. So while I do recommend them, I would suggest always seeing someone who's appropriately trained to actually intervene. And yes, they are more expensive if you go to the dentist to have it appropriately fitted. However, I think that beats ending up in an emergency room.
It's a fascinating thing to think that sleep and the way that we sleep, breathing, all these things that actually happen naturally, that happens unconsciously, and our body takes over. We're not having to drive that. Yet these two particular activities are causing and creating such havoc with our health. For the everyday person who's listening to this, the cost, the investment to actually want to heal and fix this, we're talking seeing specialists, we're talking going down the route of intense chiro, and obviously more practitioners that are aware of this, the cost of tongue tie, perhaps splints being made. I mean, are you saying this should be seen as an investment, not a cost? And this
Absolutely.
is to create a long-term or better longevity so that we skip into our grave ripe and healthy and full of zest, as opposed to going down the typical medication, slow, sad death kind of thing that seems to be our modern way of dying. If that's the case, what are we, I mean, you know, there's an investment in this. Have you got a figure, or are you thinking about what this looks like for someone? And then perhaps even more importantly, what's the cost of not doing it?
Well, the cost of not doing it is significant decline. Now, one of my first things that I ask my patients when they start with me is, where do you see yourself at 90? And people will say things like, not dead, which I think is an abhorrent answer, as against, you know, I would like to be, you know, climbing Kilimanjaro or running the Boston Marathon or doing something dynamic. Now, the cost of not breathing efficiently and not sleeping well is the inability to be dynamic at 90 years of age. Now, people kind of go, oh, but you decline. That's the normal thing. You get old and rubbish and you sit in a chair and stare at the television. Well, that, I believe, is because of these dysfunctions. Tongue tie is a lot more common than you'd imagine. Now, there are other things that tie into it, just as an aside. As it turns out, the literature shows that interventionist births, including C-section, von Teuse deliveries, forceps deliveries, are very prone to causing what's called cranial drift. And so the talking on the skull creates alteration in craniofacial structures. This is why in my book, I'm positing the concept of OFMS, oral airway functional maldevelopment syndrome. It's maldevelopment to the airway, the structure, the sinuses, the face, the head, the neck, for every and whatever reason. It could be because of tongue tie. It could be from chronic ear, nose, throat infections. It could be from birth deviation, birth trauma, etc. Now, to make those statistics even more interesting, in the year 2022, which is the most recent statistics I have, 50% of all births, and there were over 300,000 live births in Australia, 50% of them were interventionists, meaning C-section, von Teuse, forceps delivery, which says that there is a very large and growing population of people that have the capacity for oral airway functional maldevelopment, occlusion of the airway, fragmentation of sleep, and many of these disease processes starting from very early on. Okay, that is one of the motivating things for me. Now, the problem, as you were asking about, is there a financial true cost? There is. I don't know. I've never taken the time to look at this because I consider it something so important that I think it's a cost that needs to be paid as an investment. Now, again, as I noted, all three of my daughters had tongue tie. My youngest daughter has had significant ADHD, as it turns out, all her life. Found it incredibly difficult to hold her personality together, to turn out work, to thrive in a school environment. She's had a terrible time. And what we saw after we had her tongue tie removed is her sleep instantaneously improved. Instead of kind of poking her with a stick and stepping back because the snarly bear was going to take your arm off when we tried to wake her in the morning to get up and go to school, she started to become a pleasant person, and her grades have gone up and her scholastic ability has gone up. And recently, as it turned out, in her TAFE class, she was the very first person to have a fully functioning website, which is the outcome of that. Instead of her being the sort of character that would be 11 o'clock at night the night before, using fear and adrenaline to try and turn out something, her brain has started to turn back on since we had her tongue tie removed. Now, I'm not suggesting everyone's going to get these radical things, but what it taught me is that sleep fragmentation has a massive impact on cognitive function. So if you're not breathing effectively because your tongue is choking you through the night, the brain has to defend your airway. So it starts introducing chemicals to create muscle tension to pull the tongue out of the airway. What this means, of course, is that you start to come out of your sleep cycle to defend that airway, which breaks wherever you are in the sleep. So REM sleep, where a lot of these fragmentations of the airway occur due to the muscle paralysis, is where the brain consolidates memory. It's where the brain seems to detox the stresses of cognitive function of the day before and helps us reset our emotional neurocognitive state. Deep sleep is where we seem to repair the body. Now, you can get airway fragmentation and disruption of sleep in both sleep cycles, but it seems to be occurring more in REM phase. And there's a bunch of reasons, which I think will probably get a bit too technical for today. But what we found in my daughter's case, and again, maybe in no one else's, but this is my experience with her, is that removing the tongue tie gave her a window of opportunity, and it's increased her ability to function in a normal school environment and turn out better results. And so if it can happen for my daughter, it may be something that could improve some other person's life. And we need to talk about this. We need to get hope back into parents' lives for their kids that are having a hard time. It's such an important area.
So critical for the welfare and well-being of parents who are usually so damned exhausted and upset and concerned for their children and would do anything for them. So getting the right encouragement, advice, and support is critical in these situations. I'm just curious from your perspective then, Scott, you've had 3 daughters. All 3 of them have had challenges. Is that because of the MTHFR gene, or is it because of both of you being tongue-tied, or have you found other reasons as to why your beautiful 3 daughters created these challenges that sent you down this pathway?
Well, I definitely think MTHFR is part of it. Now, again, if you extrapolate backwards, I've done both my wife's and my own epigenetic profiles. We both have MTHFR as part and parcel of that. So there is an inherited feature. And again, soon after I found this, I offended my wife greatly by saying, well, perhaps we should have stopped at a one-night stand. Surprisingly, that was far less funny than I thought it was when I said it. Lessons learned. Can't put the kids back is a simple thing. But, at a basic level, MTHFR definitely plays a lot of havoc in connective tissue development. It plays a lot of havoc in the creation of neurotransmitter production and how we run our brains, how we run our bodies, how we detox, how we use muscles. So it's not the only thing. And people get hell-bent on MTHF being the only thing, folate being the only thing. It's just a part of the symphony. But if it's dysfunctional, there are probably other things, and we need to account for it and see if we can do things to make it work better for the person. But because of MTHFR issues, we may see more connective tissue disorders. This may mean that there is an oral airway functional maldevelopment. They may have a greater need for good orthodontics and myofunctional work to strengthen the jaw. We need to look at the quality of the diet, and you need to get well-trained, open-minded, holistic practitioners. Again, this is not to defame anyone, but the classic medical model, in my experience with my daughters, was not providing answers. Again, as I said right at the beginning, classic chiropractic didn't provide answers for my daughters either. I tried taking my daughters to the best practitioners I could possibly find, including my uncle, who is an exceptional practitioner, but we didn't get the answers there. The epigenetics made a big difference. The diet made a big difference. Neuro rehab training made a big difference. Removing the tongue tie allowed an improvement in sleep. And when I look back on my middle daughter, she really stopped sleeping that I could tell you absolutely about 2.5, 3 years of age. Sleep was always a problem. Now, as it turns out, she was probably waking somewhat frightened in the night with a rush because of her airway fragmentation. Now, again, that's my thoughts and extrapolation, but she couldn't get herself to stay asleep. She came out every night. She'd fragment, go to sleep, wake up, go to sleep, wake up. My eldest daughter would wake in the middle of the night at 18 months, screaming, bashing her head into the floor. That was fun and games. So sleep, as it turns out, for all three of them was a major challenge. And it's led me to the point that I believe we need to be assessing sleep and airway as a screening program for all children till about the ages of 3 to 5. Okay? We need to look at it early. We need to recheck it, and don't assume because they are catatonic that they're actually sleeping properly. And as a classic statement, unless your child has a rip-roaring sinus infection or flu, they should never be sleeping with their mouth open. Okay? Never.
When you think about this, though, and I want to go back, because you're saying since the 70s we've had this huge increase. And if I'm hearing it right, this is coming back to what we've been feeding or how we've now got into this industrial processed food revolution.
Yes.
If that's the case, then surely we can reverse this. But don't you think that the food manufacturers and the technology and laboratory companies have a lot to answer for?
There's a poisonous question if you ever heard one. In the first instance, yes, I believe that we can change our health outcomes. To do so requires change at a societal level. We need to have people aware enough to make a difference with their buying habits. But the problem is that good quality, organic, biodynamic food with high levels of nourishment in it is horrifically expensive. And we currently exist in an environment where our lords and masters believe that we should make life significantly more expensive, keep pushing up house prices, keep pushing up, finance charges, and try to push us all out of work because that's meant to get inflation under control. So our food costs to actually solve this, our supplement costs potentially to solve this, our good quality practitioners, all those prices are going up. So it's becoming harder for people to achieve those resolutions because our society needs to change. We need to push back and say, no, that's enough. We need to not listen to what is really an industrial agribusiness that's in bed. Like, there's so many inappropriate concepts out there. People will have kind of lived through the experience, for instance, of eggs. Eggs are bad. They're full of cholesterol. It's going to harm you, and cholesterol's bad, right? Well, that actually came out in the 70s from the US government because they were worried about their inflation costs going up as they were after the oil shock, and the price of eggs was going up. So they discouraged people and they put information out into the wider area saying that eggs were going to harm you, and people are stuck with it. I still get questioned about eggs 40 odd years later, and it's all total poppycock. So it requires a significantly greater societal change than just, well, you just eat right. But each person has the capacity, and they can vote by not buying packet food, not buying high sugar, high carbohydrate, low nourishment foods. They need to eat things that look like food. Unfortunately, for a lot of people, lots of people have different beliefs in diet. I believe we're omnivorous and that we need vegetables and animal sources of protein because that's where most of the nourishment that drives human health and well-being comes from. We need things that are severely chewy and hard and pulling so that the children are having to masticate and use their jaw muscles to develop the facial structure. If we don't eat old-fashioned food, and by old-fashioned, there are groups out there that talk about the traditional styles of diet, like the Aboriginals or the Inuit have eaten. And there are foundations that give the insight of how we've always eaten. And these are things that we need to get back to and not just kind of giving industrial food manufacturers who the laboratory techs, as you mentioned, their job is to find a way to get people to consume hyperpalatable food. The more salt and sugars and fats that you put in it, the more likely you are to want to consume it. You just got to get the balance right so it tickles the brain in the way that says, well, I'm threatened. So the more of these foods I consume, because threat response drives sugar levels to go up. And therefore, we are hardwired to hunt for foods that allow our survivability, that put fat on for the future. Because traditionally, threat was no food or water, no salt, or someone trying to violate my personage. So if we store fat for the future, we are likely to survive. And those foods, the more carbs you can get in, the more your brain feels like you're going to survive the threat, right? Yes, I think we do have a scenario where these lab techs are truly responsible for some horrific health outcomes. But in fairness to them, they are just doing what they are paid to do. It's the profiteering on ill health that really we need to change in our society.
It feels overwhelming sometimes, Scott, very overwhelming with what you're saying to make all these changes. Because, I've been doing this for 43 years and, only a percentage of people are making those changes. And it feels overwhelming also that what have we done? What have we done to our beautiful children, our planet and everything else that's happening? And I hear this more and more where our kids are sick with chronic disease, not only physically but mentally. And, that number is growing. I see the foods that our parents or the parents give their children, and it's, because we have the equipment now, it might be a smoothie with all the good nutrition in it. But what you said, which really piqued my thoughts about this, is a lot of kids are choking on food because they haven't had the practice of chewing food from when they leave the breast. Instead, they're being given soft food smoothies. And do you think that this is another reason why we're not developing that vagus nerve and that we are having all of these problems? It just feels overwhelming right at the moment with everything you said, but I understand there's also an answer always. So if there is the first step, because I know there are many steps and I get that, but if it was the first step, would you still consider diet the first step for these kids, these adults, this snoring, everything like this? Would you consider diet to be first step, or and if it is the first step, then can you give us the steps that you would do after that first step, if it is, and even if it's not, just give us the steps.
No trouble.
I'm here with pen and paper waiting.
Right. So the answer, surprisingly, is no, I don't consider it the first step, but that depends on what age of person that we're talking about. So the very first thing that I would suggest is breast is best, and we need to, and I'm about to offend some of the lactation consultants, we need to look at how we're breastfeeding. And I talk about this in my book. So breastfeeding and how we breastfeed and the position we breastfeed determines neurological development of the child's brain. Okay. It all starts from the suck, swallow, breathe response and a bunch of other things and around it. And I go into all of the primitive reflexes, how sideways feeding. So, how it kind of starts. We climb out of the womb, so to speak. You're born, you crawl up mum's tummy, and you use a reflex called the Moro reflex to bind onto mum, hold and hug her, and bind mouth into the breast. And it is a tummy to tummy, head towards head postural position, which is kind of called the kangaroo or, papoose style position. It's body to body in a vertical alignment. Now, this has been kind of almost discouraged, and I think partially because of convenience and lifestyle and other factors. But from that position, what occurs is baby binds on, the tongue fits underneath. And if you think about the shape of the breast, the lower portion of the breast of the nipple generally uplifts, which fits with the mouth shape. And so the mouth open engulfs and envelops and sucks the whole thing right to the back, with the tongue pushing the breast up into the roof of the mouth. And it has this rhythmic pattern, and it incorporates how we suck, to swallow, to breathe in this rhythmic training pattern. And it activates head movement and cranial plate movement, cerebrospinal fluid movement. And what then occurs is the eyes look straight up at mum's eyes. Now, this activates the vestibular colic, vestibular ocular responses. So eyes go up. This extends the extensor muscles in the neck and the spine. So if you are sideways feeding, you're still looking up at mum, but you're looking out the side of your eye, and you're activating different nerve centers in the brain and the brainstem, and therefore different muscles. And this is a major trouble. So the first steps is, in my opinion, we need to look at how we're breastfeeding. Now, sideways holding and feeding is more convenient. It's politer in public. You can hide things a lot easier, as against having to have the baby leaning. You need to be reclined and relaxed, and the baby is holding on in a very different position. We need to be developing a screening program for these kids. Always. We need to make sure that airway is as free, and the structural shape of the mouth, which then affects the sinuses and the eye palate. So the malar bones sit underneath the eye and form the base of the eye socket itself. So if your mouth is narrowing, your bone structure will invigilate into the sinuses and alter eye position, and therefore the pull on eye muscles. And we're seeing an increased alteration in people's vision, higher amounts of astigmatism. They're all interrelated to this scenario. So from there, as our first step societally, we then have to look at then breathing. Are we breathing effectively? Because fast breathing by itself will cause problems. If you're going to burn off all your carbon dioxide, increase your oxygen in the bloodstream, but you're also increasing acidification, which is bad for bone development in the first place. Then we get onto food. Food is kind of second equal to everything else. Like you can't separate diet and nourishment and building blocks from any of those other things. But a good diet cannot outstrip narrow sinuses, narrow airway, tongue in the roof of the mouth versus tongue falling into the throat, because when they go to sleep and the tongue falls into the airway, your brain has to wake up to defend the airway. So a good diet can't stop that. So you have to look at those structural features and the neurodevelopment of how your brain is using the muscles of the airway, regardless of anything else, in my opinion. But no matter what, there's always hope. Every one of these scenarios has an answer, and we can improve upon it, in my opinion.
I can hardly wait to read your book. I'm gonna get that. I'm going away for a little while. I'm gonna grab that book and I'm gonna read that and understand these things, because I've always been about anthropology and, when it comes to nutrition. And what you're actually doing here is showing us what we did do before modern civilization started, and perhaps what we have to go back to. And while I find it difficult at the moment to comprehend all of these things, I realize as you're going through all these things, it is just going back to the old-fashioned principles of how we lived, what we did, how we did things, as opposed to making up something new. It's actually not new. It's quite old. We've just got to relearn it. Am I right in saying that, Scott?
I think that's an excellent way of putting it. Perhaps we have to relearn a new twist on old things because, no matter what, our society is, hundreds of years removed. We don't live in the same environment. Our food does not look the same. So we have to adapt, but we need to bring those old-fashioned behaviors back. The slow food movement, chewier food, less processed food, higher nourishment amounts, probably less food to a large degree. We need better nourishing food with less calories in it. We don't need to be kind of drinking out. Like, one of the worst things is drinking your calories. I'm not a great fan of smoothies. I don't recommend juices. Soft drinks are like alcohol. They should be once in a blue moon sorts of things. You shouldn't drink your nourishment. Chewing is much more than just getting calories into you. Chewing is a neurological occurrence. It's an alteration of the vagus nerve, because the vagus nerve going all the way down to your digestive tract is a beginning point in the mouth and in the throat and in the brainstem. And if you don't get that suck, swallow, breathe, or chew, swallow, breathe method working and developed appropriately, then we do end up with problems. Now, one of the very simple things that most people forget about is the quality of your muscle mass and your development and how you use it kind of peaks somewhere around 22 to 25. So if you haven't learned to use yourself really well with great development, that's your maximum level of greatness, and it's declined from there unless you start rehabilitating and working on yourself. So when you lose muscle connection, when your brain can't talk to your muscles effectively, then your brain starts to decline. You lose the brain cells. So again, think of it in the same way. If I put your arm in a cast, it was perfectly fine. I put you in a cast for 6 weeks. How does your arm look afterwards? What's your capacity to use it after you've been in a cast? Poor, isn't it? You lose muscle.
Very poor. You lose all muscle. It's an absolute mess.
So what happens to the brain cells? You haven't been using the brain cells that connect to that area. So if you've never really used them, that means those brain cells never really got used. And your brain is very expensive kind of architecture. If you don't use it, you will lose it. Your brain won't carry anything, including brain cells, that costs it large amounts of resources. And so we decline. So my goal is to get people to thrive from early. But remember, today is the first day of early, because early is any day before dead. Any day that you can work on you is a good day.
True.
Sorry,
Kimmy, just one comment and then I'll let you go. I just was listening to a podcast, and it was about President Kennedy and an interview that he did. And the interview asked him, what do you think is the most endearing trait that we need as a leader? And he didn't say courage, he said curiosity. And Scott, I would say you're the most curious person that ever existed.
Oh, thank you.
Yes, in that you've obviously been curious about stuff. You've been made to be curious about stuff. And I'm just blown away with your research. Like, it's all good to be curious, but not seek the truth. But it feels like that you've done that. So I just wanted to compliment you on that. And Kim, it's all yours.
Oh, no, I was going to add into that. The rabbit holes that I go down with this gentleman is beyond. And what I love about it is we don't know what we don't know. And if we're not curious or open to these conversations, or at least listening and letting this information land and then digesting it for ourselves and looking at, I think, what I would call this very holistic, big picture observations here that Scott's given us, then we are limiting ourselves to healing our nation, ourselves, each other. And so whilst we can, as you say, blame the food companies or look at it from that perspective, they've been doing what they've been told to do. But I would encourage every one of our listeners to book in and see someone like Scott. And I'm sure if you go onto his website, which we will give you all of the details, you will not only find his book and be able to get his book, First Principles, the Myo Nozzle, but you'll also get an understanding of what you're looking for in a good holistic health practitioner. Scott, if there was one thing to close with this, I mean, we could talk to you for hours and days, and honestly, I never tire hearing your voice and the way you look at things. But if there was one final message to our beautiful Up for a Chat listener, and perhaps you could add into that how they can get in touch with you or find your book or get this nozzle, could you give us a little beautiful closing statement or something that you'd love us to know?
Right. I liked what was being said about JFK. I think he was an excellent being, and the world is a sadder place without him. I think the other thing that is essential for all of us is hope. And hope allows the capacity for change. Without hope, we are whatever we are. You're not going to alter. So if there was a message I would sell, it would be that hope is the essential thing to pair with curiosity, because it allows you to imagine different and better and moving forward. And that's what I want people to do. No matter how bad a moment might be, we can hope and we can make a difference and we can keep moving forward and keep trying to change to make the world a better place. So that would be my ultimate take-home message. My concept behind the book as a slogan is Sleep, Breathe, Heal. And what I want people to then take on board is that if you're not sleeping well, if you're not breathing well and oxygenating your brain, you're not doing as well as you could do. So as part of the hope I want for people is that they will look at their airway and look at their sleep hygiene and try and make an impact on it, because it is the most overlooked areas. People take their sleep for granted. Oh, I just sleep. The quality of our bedding makes a difference. The quality of our environment, whether the bed can hold on to moisture, grow mold. All of these things impact your sleep hygiene, and we take them completely for granted. Our bite position, our jaw structures, all of these things are essential. And I would hope that as a society, we can start thinking about looking at children with a screening program so that we can grow better, healthier, more functional, more vibrant, more active humans to make our society a better place. And that's the dent on the universe that I would love to make, is that if we look at these things and start changing our children to make them healthier, the world becomes more connected, more holistic, healthier, and happier. Please, anyone who's interested in the work, please reach out. My book, First Principles, is available on pretty much any platform, Amazon, my website, which you can find at advancedrehab.com.au or optimalsleepairwayhealth.com. I'm hoping that people find it interesting. I'm hoping that they might have questions. I'm even hoping that people will challenge me and say, no, you're wrong here. I believe I have a really good thesis. I believe I've got a lot of the parts of it. I don't believe it's a finished thesis. I don't have everything. I'm not that narcissistic. So being challenged means I have a new area to study and add data. I'm more than happy to change anything. If someone can prove I'm wrong, great. Book 2 will come out so that I can then keep the concept going, because the goal is to make healthier, happier people. Sleep, breathe, heal. It's not done yet.
Yeah, I'm sure it's not. And Neither is your research by the sound of it. Scott, on behalf of Kim and myself, I want to thank you for spending well over an hour with us in the most informative and inspiring podcast. I will be reading your book. I will be learning more things about the principles that we need to be the best we can. And once we're off the air, I'm going to ask you a few more questions, and everyone's going to go, no, don't go. Let us hear your questions. But maybe I'll give that. We'll do that again afterwards. So yes, thank you on behalf of Kim and I.
Thank you.
It
was a great
Scott.
privilege.
You're an amazing chiropractor, an incredible researcher, nutritionist, biomechanical expert, biochemist, unbelievable. The list goes on, actually. Supernova human is what you are.
Thank you again.
Thank you.
This has been a production of TheWellnessCouch.com. Check us out on Facebook and join in the conversation on Facebook.com/The Wellness Couch. Subscribe to each show on iTunes and check us out on Twitter. The Wellness Couch, streaming wellness into your lives.
Whilst the Wellness Couch presenter endeavor to provide accurate and helpful information to their listeners, these podcasts cannot take into account individual circumstances and are not intended to be a substitute for health and medical advice from a qualified health professional. You should always seek the advice of a qualified health professional before acting on any of the information provided by any of the Wellness Couch podcasts.